The National Newspaper Publishers Association represents 253 African American owned newspapers across the United States. We are the trusted voice of the community, reporting the news on freedom, justice, and equality. Benjamin F. Chavis Jr. I'm very honored and pleased to be able to spend some time with Congressman Jim Clyburn, the distinguished member of Congress from the 6th Congressional District of South Carolina. Jim, you've been in Congress 17 times?
Well, I don't know about the terms, but it's 32 years.
That's a long time.
Yeah.
That's a long time.
Thank you.
So much is going on in our society. I see the Congressional Caucus named healthcare is one of the major issues facing the future of the nation. But I want to focus on one aspect, and that is Medicaid. Tell us what you see as the challenge and the future of Medicaid.
Well, I think in order to really understand the present, prepare for the future, you can look at the history. I used to teach the stuff when I was growing up. My dad made me read a lot. I didn't like it then. I'm loving it now. And so I learned that history is to be instructive. And we were taught by most writers, George Santayana most especially, wrote, if we fail to learn the lessons of history, we're bound to repeat them. Now, the fact of the matter is we know that healthcare historically has been a problem for everybody, especially those of lesser means. And so back in 1965, when people were focusing on things like the Voting Rights Act that came about as a result of Bloody Sunday, February 1965, in Selma, Alabama, we focused on a lot of things. But healthcare was not exactly the focus of the public, but it was of the Johnson administration. And when I hear people talk about the failures of the Great Society, I remind them that Medicare and Medicaid were both products of the Great Society. And I cannot think of anything that's been more impactful than those two things. And Medicaid, so much because it affects people of lesser income, but it also impacts people of significant income. And why do I say that? It's because today, one half of the children born into this the world in this country come through Medicaid.
One half of the children.
That's right.
That's a big number.
That's a big number. Now, on the other end of that spectrum is the fact that 40 to 50%, I'm told, of the people who are in need and get nursing home care, they come through Medicaid. And that affects everybody, no matter what your income is. Right. If you got a mother or parent, should I say, or grandparent in need of nursing home care, chances are you are going to be in dire straits if you have to take care of all those bills from your middle or even upper income salary. So Medicaid is one of the most impactful things going. I mentioned my dad earlier, but one of the things he used to say to me all the time, son, if you got good health, all other things fall into place. And so what we have to do, if you're going to have a good, healthy populace, if you're going to have a productive workforce, healthcare must be priority for everybody. And so that's why Medicaid is so important. And that's why we Democrats have decided to throw down the gauntlet when it comes to health care. I can go across the spectrum in so many other things affecting health care, but Medicaid, I think, touches more people than anybody. And the mistake a lot of people make is the fact, well, health, Medicaid, that's for poor people. Yeah, it is. But it affects everybody, and it's a benefit to middle-income Americans as well.
Well, Congressman Clyburn, you've stated well the impact of Medicaid. Given the truth of what you just said, why do you think the government is backing off of funding for Medicaid?
Well, nobody likes to say this, but when you get to be my age, you don't worry about whether or not people like what you say.
Yes.
I'm going to just tell the truth about it. And the fact of the matter is that there's a significant effort being undertaken in this country today to create two societies in this country: lower income and upper income, and eliminate the entire middle class. What's made this country what it is today is the fact we've had a strong middle class in this country. You eliminate health care. You get rid of all the programs designed to keep those, what I call, bad faith people from making decisions about housing. And we just heard that this administration decided it's not going to enforce fair housing laws. Well, we created the middle income in this country basically through housing programs. When those soldiers came back from World War II, the suburbs basically were built by the GI Bill. And we got this big gap between black and white was the fact that the white soldiers that came back from World War II got the benefit of the GI Bill for education and housing. And the black soldiers that came back did not get the benefit to the same level. In fact, you go back and check this, because I've done it. For the first 3,600 grants, GI Bill grants in Mississippi, of the first 3,600, only 2 went to people of color, to black people. Not 2%, 1, 2. And that was the case all over the country. And I often marvel at the fact that the Tuskegee Airmen, now we're having people saying, as one gentleman, part of his legacy, the fact he says, if you ever got on an airplane and saw a black pilot, you would question whether or not he was qualified. Nobody questioned whether or not the Tuskegee Airmen were qualified to help win World War II. There were fighter pilots who did not want to go up unless they had those red tails accompanying them, riding what we like to call shotgun for them. Why? Because they were highly qualified, and they made movies about them, but wouldn't give them the GI Bill.
As I listen to you speak from not only a historical perspective, but very contemporary, it seems to me, Congressman Clyburn, that in terms of the public policies of current administration, you say they're eliminating the middle class.
Yeah.
If a democracy erodes from the middle, what is your perspective about the future of that democracy?
Well, I've said to a lot of people, and it took me some time to get to this point, Well, I actually believe that the next 18 months will determine whether or not this country continues as a democracy. I think you'll have activities, political activities taking place this year, most especially in Virginia and New Jersey. There are a lot of local things taking place as well for those two statewide contests. And then you're going to have what we call the off-year election next year.
Right.
And if there's not a reversal of what has taken place over the last 2 years, there will not be a democracy in this country in the next 5 years. There will just absolutely not be. Now, Jim Clyburn has been saying this since 2018. A lot of people told me that I was being hyperbolic, but I'm convinced that I'm right about that, so much so that Rachel Maddow several weeks ago made some comment to the effect that she thought we may have crossed that threshold. I'm reading and hearing from people now, articles being written, whether or not we have, in fact, taken a giant step toward autocracy. And if that is the case, and it's not reversed over the next 18 months, there will not be a democracy in this country. We'll never have another election, what I would call fair and balanced election.
The intersection between Medicaid and voting rights and voting.
Sure.
It seems to me that millions of people who are going to be impacted by the reduction in Medicaid, they should be the first going to the polls to vote.
Absolutely. You know, and what I think that people have to understand is Medicaid, by another name, is still Medicaid.
Yes.
So if you're living in Arkansas, it's called something else because the people in Arkansas decided, the Affordable Care Act now,
Right.
which is a part of that. The Affordable Care Act is what brought, I think, we went from 25 million people without health insurance down around 10.
Yes.
And that's creeping back up again. And so everybody says, well, we want to provide health care for people, but we don't want them getting that Obamacare. So in Kentucky, they call it Connect. In Arkansas, they call it something else. A lot of other states is given it another name. In South Carolina, there is another cute name for Medicaid. And so
they just don't want to give Obamacare credit.
Absolutely. Absolutely. And so I tell people all the time, when you say, well, I don't want no Obamacare, but I want my Connect in Kentucky. Enjoy your Connect, but thank Barack Obama for it, irrespective of what you call it.
I know your time is very limited. What is the prospect, from your informed perspective, of getting a bipartisan support of reemphasizing the importance of Medicaid, and Medicare?
Right.
I know during this open enrollment period, they have pulled back even the advertisement to even let people know about open enrollment.
That's right.
So you say 18 months. I think that you're right. But it seems to me that, and the question is, between now and November 2026, what should be the clarion call to get the people on Medicaid to the polls? And if the Republicans don't work with the Democrats, which it appears like they're not, what is the Democratic Party going to do to fill that gap?
Well, the Democratic Party can't do a whole lot without the voting public. You know, I hear people talk all the time, Democrats, y'all just don't have a message. No, y'all aren't listening.
Right.
You aren't listening. And then you aren't paying close attention. The fact of the matter is, if you have a media conglomerate like you've got in this country, and the Washington Post, one of the most respected newspapers of all time, decided that they are going to no longer fact check this president, let him say anything he wants to say, when the owner of the newspaper refuses to let his editorial staff who are learned people who are there every day, who observe everything and decide that we are going to write an endorsement of Kamala Harris. And the guy who owns the newspaper comes in and says, no, take down that endorsement. Yeah. And then you says, Democrats, what you going to say? We are at the mercy of that. And then it means to the voting public, some people say, oh, you got to learn to vote with your feet. Yeah, that's true. But you might need to vote with your hands as well, because it's your hands that reaches into your pocket to buy those newspapers that's now the guy who is spent $50 million for a wedding decides that he's not going to let that Democrat be endorsed by his newspaper. And then when you look and you see comedians who are progressive being taken off the air because this administration decided that person should not be allowed to speak. That's taking away your First Amendment rights. So the First Amendment right should not be guaranteed. But the Second Amendment, oh yeah, the right to bear arms, always guaranteed. And so I say to people all the time, we Democrats are doing everything we possibly can. We are giving out the messages. But if the newspapers refuse to print it, the television refuse to let it be heard, is that the Democrats' fault? That might be something that's falling on the public to do something about.
Well, that's why we have the black press.
Absolutely.
And that's why we're interviewing you.
Yeah.
Because you know you're going to tell us the truth.
That's right. And I've been writing stuff for you for a long time. Exactly. And I still want to do that. And I still want us to enhance your ability to get the word out. Because I think that we have gotten where we are today because of two mediums. Of course, you always pluralize the media. Yes. I notice that you all don't do that much anymore. But the media are very important to me. And those two mediums that I have reference to, the black press and the black church, have been the salvation of the black community. And I do everything I possibly can to help put both before the American public.
Congressman Jim Clyburn, on behalf of Events DC and the National Newspaper Publishers Association, thank you so much for sharing your wisdom and I would say your prophetic vision of the future. Thank you.
Thank you very much for having me.
We are the official host for the nation's capital. We are all things sports. From captivating culinary to celebrating legends and so much more. We are Events DC.
Let's go bigger, I'm that killer. Coming in hot, make you jump like a thriller.
World-class people delivering world-class events. Events DC.
I'm Benjamin F. Chavis Jr. I'm very thankful to Events DC and the National Newspaper Publishers Association for giving us an opportunity to talk to one of our nation's leading health care experts, Rhonda Mims, Executive Vice President of AmeriHealth, and you're the Vice President for Public Affairs and Risk.
Correct.
That's a big title. It's a big responsibility. Tell us what you do at AmeriHealth.
Well, I'm responsible for, making sure that our members are communicated to on a regular basis, but also making sure that we're up on the Hill having conversations with lawmakers about the importance of Medicaid. AmeriHealth Caritas is a company that's in 13 states, and what we really do is ensure that we're treating the folks holistically, making sure that they have social support services and that they are given the opportunity to have all the resources they need to have a healthy lifestyle.
There's a big challenge today on the question of Medicaid. From your perspective, how important is Medicaid to all communities, particularly those from underserved and underprivileged communities?
Well, let's think about it for a second. Who is a typical Medicaid person? somebody who may be having a low income, what we call, unfortunately, the working poor. But about 80 million people today are involved in some type of Medicaid program.
80 million?
That's correct.
That's a big number.
That is a big number.
And in terms of what you do at AmeriHealth, how do you raise public awareness about the Medicaid issue?
Well, I think that's a challenge because not everyone is comfortable with, I guess, what we would call the politicians talking to them about Medicaid. So we try to partner with community organizations, those that are trusted in our communities, because we know we're a vulnerable population. And we also know that a good many of the folks who are on Medicaid are considered, like I said, the working poor, but 92% of them are either working, disabled, a student, or have some type of illness. So it's more than likely that you know somebody who's on Medicaid. And so you could help us with making sure that they continue to stay on Medicaid, that they are enrolled each year, and that they receive the benefits that they need. We partner with state agencies across the country, red and blue states. And so the important part for us is to not only partner with the states, but partner with community organizations.
So having a bipartisan perspective enables you to be more effective.
Correct. Because again, Medicaid affects all types of people, whether you're red or blue or purple. So what that means is that, when we're out talking to you, politics aside, you're in need. You're someone who needs the benefits of Medicare and Medicaid. And so in order for us to speak to you, we got to meet you where you are. So if you're at the laundromat, we may show up at the laundromat to talk to you about enrolling. If you're at church, we might show up at church to talk to you about your health benefits. So we're everywhere.
I always ask this question. What led you to pursue a career in healthcare?
When I started out as a lawyer, a government lawyer, local, state, and federal. And when I transitioned over into corporate America, transitioned over to financial education, financial literacy, working for a big global financial company. But it wasn't until 2019, I transitioned over in 2016 over to healthcare. It wasn't until 2019 when I had my own health scare that I realized the importance of advocating for yourself and realized that not everyone has the education that I might have to be able to talk to their doctor, to be able to understand what the doctor is saying, and to advocate for themselves. So based on all of that, I decided that I needed to stick with mission-driven organizations like AmeriHealth Caritas. We're really, really focused over 40 years of making sure that people receive the care that they need.
So your lived experience brings more definitive awareness to all of the issues that AmeriHealth deals with, but particularly Medicaid.
Correct.
So how do you see the future with Medicaid? Do you think it's going to be able to have sustainability? There are questions about future. If you could forecast over the next 4 or 5 years, what do you think would be the sustainability of Medicaid?
I think we're going to have to work with our state partners to help continue to educate them. They're the ones who know what their citizenship needs. They're the ones who helps fund, Medicaid. So there are appropriations bills floating around in various states. But at the end of the day, people are going to need health care. And in order for us to ensure that they do, we're going to have to spend time with the state agencies, with the federal government, but more importantly, with advocates who can speak up on behalf of those who can't speak for themselves. So I think the future is bright. There will be some changes, don't get me wrong, but we have to, as a health payer, we have to work with the state agencies to make sure that, they don't lose people in the enrollment process. There's a new law that's going to require recertification every 6 months. And what
Every
that
6 months?
every 6 months. And, some people may say, well, that's a burden on those folks who are already just struggling, right? They're struggling with making sure they have housing and food security and all those good things. And now they have to worry about being, registered to be able to receive Medicaid. So we're going to work with them. We're going to spend time with them. We're going to meet them where they are and help them stay enrolled.
You're originally from South Carolina. I'm from North Carolina. And look,
Real South Carolina,
right.
real Carolina.
The real reality is in our communities, a lot of people fear going to get health care for a number of reasons. How do we overcome that? You've mentioned the importance of federal, state agency, but also that engagement at local community levels. So how does your job with public affairs reach to make sure that there's community engagement?
Well, I also am chairman of our foundation. So from time to time, and
Oh, that's great.
so I am out looking for organizations to partner with to be able to get the message out. I, have responsibility for marketing for the organization. So, how we speak about Medicaid should change, and so that people understand that they are on Medicaid. Because there was a discussion at some point that not everyone recognized when we were having these debates in D.C. what what could impact them. So my job is to make sure that I'm funding the right community organizations, that I'm showing up with, I guess the right capabilities, the right tools from our company, folks who can relate to folks, that I'm going to people's homes, that our caregivers are recognizing when folks are in trouble or at risk and raising it to our attention so we can give them more needs, but also making sure that we're going beyond and looking at innovative tools. AI is going to be big for healthcare. So Medicaid shouldn't be left behind in that regard. So finding the necessary resources, the tools, and all those things that we need to do to make sure that, we stay in the forefront of advancing Medicaid.
The AmeriHealth Foundation, does it cover all 13 states?
Yes, it does.
You mentioned AI. It's a good segue. Technology, the innovations in technology are driving a lot of the economy. From your perspective, how is artificial intelligence and other technological advances affecting the delivery and accessibility to Medicaid and to other healthcare?
So another change is this work requirement discussion that you might have heard. And I mentioned earlier that there are folks who...
For those who are able to work. I
Correct.
don't know how you
Correct.
determine that, but
Correct.
go ahead.
So we're going to be working on some tools that will allow us to tap into AI to be able to certify when people have applied for jobs or have jobs, that they can use these tools to look for jobs. Another example of AI in healthcare is, we have a partnership with an organization that uses doula-led, maternity health type work, but it's all driven by technology. So it's like a virtual kind of doula-led program. But then there's another one where we're using a virtual autism testing. So, we're tapping into AI in all aspects, but more importantly, making sure that when we tap into it, that we're educating our membership around how to use it.
Yes. There's still somewhat of a digital divide in many of our communities. So not only the question of accessibility to healthcare, but accessibility to the technology. I'm pleased to hear that AmeriHealth is working on that. I think it's vital. Speaking of younger generation, we live in a social media age. How do you utilize social media in your job as Executive Vice President for Public Affairs?
Another example, we just had a what we call Healthy Hoops. It's a program that has been around for a number of years. We go out into communities and we teach kids about staying healthy while, playing basketball. So we were in Indiana last Monday with the First Lady of Indiana, and we had a Healthy Hoops program bringing in young people from that community, teach them about basketball, staying healthy, and doing all the things that they need to do to have a better life. And so from my perspective, the next generation of folks is doing quite well. They're willing to learn, and they're also engaged, and I'm excited about that. So,
I always ask this question. Based on your career, based on your current job, today, what gives you your greatest hope?
I have a 19-year-old daughter, and I'm incredibly proud of her and the fact that she is a caring person, that she's open to learn and open to, getting close to folks who don't necessarily look like her. And I'm excited about her friend group. and how committed they are to giving back. Even in high school, they were going out and volunteering. So from my perspective, I'm excited about what I see when I'm not in the office. And I'm also excited about the commitment that I see from our employees because they give back. I mean, they're volunteer. We're in the middle of an employee giving campaign right now, trying to raise money to give back to various communities. So there are some bad things that happen in the world, but there's also, bright lights of hope.
So you're optimistic.
I am optimistic. I never want to give up. I am still going to, keep the fight going. I may experience some setbacks. I mean, there may be some challenges over the next few years, but at the end of the day, we're going to continue doing what we're doing because that's what's right.
Do you see that AmeriHealth may expand beyond the 13 states?
Yes.
You have an expansion plan?
We do. A part of, filling in the gaps is, looking at what folks call Obamacare, the exchange business. And I think sometimes when there's a break in, providing, benefits to folks, if they have somehow fallen off of Medicaid and they find themselves without, health care, there is the opportunity to get them on marketplace exchanges. So working with, my colleagues to expand into other areas is important for us.
Well, the Affordable Care Act, Obamacare, for many it was very transformational. I have a sister who's a physician, and her name is Francine. She tells me that before the Affordable Care Act, the majority of people would go to the emergency room to get health care. They didn't have insurance. But now, whole families go and get medical service, sometimes for the first time in their lives. So the reason why I'm bringing this up, from what you've seen in the industry, there probably is no greater industry than the healthcare industry because it affects the quality of life. Is the pendulum swinging in the right way from your perspective?
I think so. What I would say is I think there is a desire to have more managed care as opposed to just, focusing on one single aspect of it. So
Explain the difference. What is managed?
So managed care is looking at behavioral health. Is looking at, in mental challenges that an individual might have, social challenges that individual might have, as well as medical and pharmaceutical. And, treating that person from a holistic standpoint is what I think is more important. And it also helps with controlling costs because going to the emergency room is quite expensive. But if you're able to, treat the person with all of those facets taken care of, then you can control the cost a little bit too in the Medicaid space.
So the affordability of access to health care, you think will kind of level off and people will be able to afford. And of course, with the assistance of Medicaid, that's where Medicaid comes in to help people who cannot afford, good access to health care.
We can only hope, right? So the thought process, and I love it when people say hope is not a plan, but, going beyond hoping, we still have to educate people. We still have to, have conversations at the state houses and at Congress to make sure that people understand the benefits of Medicaid. And a big component of that is allowing our members to be able to speak, to give the grassroots, perspective on why this is so important.
You mentioned the hope that you have for your daughter and others of her age. And you also early on talked about financial literacy. But from this interview, I see that healthcare literacy is also important. Give us your final remarks about the importance of healthcare literacy.
Yeah, so I think you can't take care of yourself if you don't know how. So I think it is really critically important for healthcare companies to get out into the communities and to educate people. And again, it doesn't matter how you do that as long as the message is clear and received, and also using trusted advisors to deliver the message. You can't wait, again, for the politicians to do it. Community leaders have to step up too.
Very good. Rhonda Mims, Executive Vice President of AmeriHealth. Thank you so much for joining Events DC and the National Newspaper Publishers Association. Thank you.
Thank you.